Hey everyone, if this is the first time we're meeting, hey, I'm Stacy. I'm a paramedic and paramedic instructor, and today I wanted to talk about toe pain calls. Yes, you heard me right. Middle of the night toe pain calls. Have you ever been called for one? And did you think it was kind of ridiculous? Don't kill me for this picture, I'm sorry. But I wanted to talk about a big reason, a legitimate reason for toe pain that we could see out in the EMS field. It's not necessarily an emergency, but to the person, the amount of pain that they may be feeling may 100% feel like an emergency. So this condition is called gout, and gout is caused by excess uric acid that's in the bloodstream. It's kind of common in people with diabetes. Males, unfortunately, are more prone to it between 40 and 60 years of age. Obesity, just if there's pre-existing factors like obesity, diabetes, hypertension, different medical conditions, you could be at higher risk for gout. So anyway, back to what it is. It's the excess of uric acid in the bloodstream. And what the body does is normally it would just get filtered out by the kidneys and through the person's urine. Unfortunately, when there's this excess of uric acid, what it'll do is it'll stay in the bloodstream and it'll find a nice cool place to deposit. And usually that nice cool place is your big toe or your ankle. It really can be in any joint, but the uric acid is able to crystallize farther away from the core, and so that's why you see it in the big toe. So as silly as it sounds, because it's just your big toe, gout is excruciatingly painful for patients. And unfortunately, there's not much we can do about it out in the EMS field. But like I said, you're typically not going to get this call. This really isn't life-threatening emergency. I mean, there's always the chance gout could turn into an infection and there could be issues in that way. But for the most part, pre-hospitally, we're not going to be dealing with it. But just know, if you ever do get called in the middle of the night for big toe pain due to gout, just be kind, because chances are it's pretty bad. And if you're curious what doctors do for these patients in the clinics, usually they'll prescribe them corticosteroids, NSAIDs, anti-gout medications, and they'll encourage them to change their diet because it's all about lowering your purine intake, which is in a lot of different foods. But yeah, they'll encourage them to change that and incorporate some home remedies like tart cherries, apple cider vinegar, and just things to kind of neutralize that uric acid. Anyway, I made a whole informative post about this, so if you want to learn more about big toe pain, go check out my Instagram or my website, lightsirensactionems.com.